A very good evening, everyone. Welcome to our YouTube channel. So, as we continue with the series called Drug of the Day, our today's drug is Edrophonium. So, let's get started. Edrophonium, as you can see, it is an cholinomimetic drug. Cholinomimetics are also known as parasympathomimetic drugs, the ones which will mimic the acetylcholine. Okay, so here is what our drug belongs to. Okay, so our today's drug is Edrophonium, and you can see here it belongs to the class of anticholinesterase. Okay, we will be studying in detail what are anticholinesterase, what are cholinesterase enzymes, and here specifically, if you see, they belong to the reversible class and not the irreversible class. Okay, so in anticholinesterase, you have reversible class. In that, again, you have the subdivision as carbamates and acridin. It belongs to carbamates. So along with physostigmine, neostigmine, pyridostigmine, we also have our today's drug of the day, which is edrophonium, and also rivastigmine, donepezil, galantamine. You might have seen that rivastigmine, donepezil, all these are used in Alzheimer's as well, right? So this edrophonium is our drug of the day. The most basic questions you might be asked regarding this drug is the use or application. So remember, it is used for the diagnosis. Okay, it is used for diagnosis. I hope you understand what does that mean. Whatever I am writing. So yes, it is used in diagnosis of myasthenia gravis. That is the basic questions that could be asked from this. So continue ahead. First, we'll understand the enzyme cholinesterases. Okay, so what are these enzymes? You have two types of cholinesterase, the one which is true and the one which is pseudo. True is the one which is called as acetylcholinesterase. Pseudo is the one which is called as butyryl cholinesterase, first and priormost. Now, true, if you see, it is distributed almost everywhere, all cholinergic site. ये enzyme सब जगह पे होता है. If you say pseudo, ये सिर्फ plasma, liver, intestine, white matter में होता है. What is important to us is this: acetylcholine hydrolyze. ये enzyme क्या करता है? ये enzyme basically hydrolyze करता है acetylcholine को. तो एसिलकोलिन का हाइड्रोलिसिस करवाता है. एसिलकोलिन ट्रू वाले से फटाक से हाइड्रोलाइज हो जाएगा, वेरस स्यूडो वाले से स्लोली हाइड्रोलाइज होगा. मीथाकोलिन इफ यू सी, ये सिर्फ और सिर्फ ट्रू से ही हाइड्रोलाइज हो रहा है, ये हो ही नहीं रहा स्यूडो से. दैट टू वेरी स्लोली फ्रॉम ट्रू. Okay, so remember methacholine is hydrolyzed only by true acetylcholinesterase. अभी ये जो तो BB वाले है benzoyl and butyryl choline, ये सिर्फ और सिर्फ ये butyryl cholinesterase से ही hydrolyze हो रहे. If you see, they are not getting hydrolyzed from the true one. So remember, कौन किससे hydrolyze हो रहा है? Acetylcholine दोनों से हो रहा है. Methacholine is only by true and benzoyl and butyryl by them. So yes, these enzymes जो होंगे इनका फंक्शन होगा, जैसे ट्रू जो होगा वो टर्मिनेट करता है एसिलकोलिन एक्शन को, वेरे स्यूडो जो होता है इंजेस्टेड एस्टर्स को हाइड्रोलाइज करता है. ओके, ऑल्सो दिस ये जो एंजाइम्स है, इफ यू सी द ट्रू वन विच इज सेंसिटिव टू फाइजोस्टिग्मिन इज एन इनहिबिटर ऑफ दिस एंजाइम, इट इज एन एंटीकोलिनेस्ट्रेज. तो ये ट्रू वाला बहुत सेंसिटिव है टू फाइजोस्टिग्मिन, वेरे स्यूडो वाला इज सेंसिटिव टू ऑर्गेनोफॉस्फेट. तो हम अगर ऑर्गेनोफॉस्फेट दे तो वह स्यूडो को इजीली इनहिबिट कर देगा, वही फाइजोस्टिग्मिन दे तो ट्रू को इजीली इनहिबिट कर देगा. अंडरस्टूड? So this is the basic of two types of cholinesterases. Now we'll see ये कर कैसे act करते हैं. So this is an acetylcholine moiety. Okay. If you see this enzyme acetylcholine esterase, ये convert कर रहा है to acetic acid and this is the choline moiety which is left. तो ये हाइड्रोलाइज करता है और इसका ब्रेक कहाँ से हो रहा है? तो यहाँ से if you see the breakage is happening. Okay, acetic to acetic acid and choline. तो यहाँ पे पहले इनका कॉम्प्लेक्स बनेगा एंजाइम और एसिलकोलिन का, देन इसमें से कोलिन निकलेगा. एज यू हैव सीन यहाँ पे ये कोलिन निकल गया एंड देन इन द लास्ट स्टेप यू हैव एसिटिक एसिड रिमूव्ड. ओके, सो 3 स्टेप का इसका डिग्रेडेशन होगा. नाउ एंटीकोलिनेस्टरेज के बारे में थोड़ा सा पढ़ते हैं. एंटीकोलिनेस्टरेज जो होते हैं इफ यू सी, these are either esters. अभी ये क्या करेंगे, उस एंजाइम को इनहिबिट कर रहे हैं. ठीक है, सो ये क्या होते हैं, मॉलिक्यूल्स एस्टर्स होते हैं ऑफ कार्बामिक एसिड और द डेरिवेटिव्स ऑफ द फॉस्फेरिक एसिड. So remember, these are esters of carbamic acid or derivatives of phosphoric acid. The generic formula जो होता है carbamates and organophosphates का, वो होता है कुछ ऐसे. ठीक है, carbamates have something like this moiety and organophosphate have this moiety. Okay. So carbamates में अगर आप देखो जो R1 होता है, that may have a non-polar tertiary amino group. Okay, so ये है, if that is tertiary amino group, if I would say, then it is physostigmine. physostigmine में tertiary होता है. टर्शरी होने की वजह से वो ज्यादा लिपिड सोल्यूबल होते हैं, नॉन पोलर टर्शरी अमीनो की वजह से ज्यादा लिपिड सोल्यूबल होते हैं. वही इफ यू सी न्यू स्टिग्मिन, वो क्वार्टरनरी होता है, दैट इज क्वार्टरनरी, लिपिड इनसोल्यूबल हो जाता है वो, वाटर सोल्यूबल आल्सो यू कैन कॉल इट एज. ओके, सो ब्रेन में ज्यादा नहीं जा सकता. All organophosphates are highly lipid soluble except ecothiopate which is water soluble. So organophosphate से कौन सा organophosphate है which is water soluble, ऐसा क्वेश्चन भी आ सकता है, that is ecothiopate. Rest all are lipid soluble. Also the question could be on the tertiary amino group किस में होता है और quaternary किस में होता है. Even pyridostigmine has a quaternary group. So I hope we understood this. कमिंग ऑन टू द नेक्स्ट, ये बताया है इसका डिग्रेडेशन कैसा होता है. ये एंजाइम के साइट्स होते हैं, एनायनिक साइट, एस्टेटिक एंजाइम के ऊपर ये साइट्स हैं. तो ये जो एसिल कोलिन का मोइटी है, ये दोनों से जाके बाइंड हो जाता है, एसिल एंजाइम कॉम्प्लेक्स बनाएगा जो हमने फर्स्ट स्टेप देखा था. उसके बाद क्या होगा, इसका इसका एंजाइम को वो एसिटाइलेट करेगा. इफ यू सी, ये एंजाइम को एसिटाइलेट करेगा, एसिटिक एसिड और ये कोलिन, ये एनायनिक साइट से जो बाइंड हुआ है. ठीक है, एंड देन उसका रिएक्टिवेशन होगा, मतलब ये साइट्स जो होंगे वो फिल क्लियर हो जाएंगे एंड अगेन इट विल बी बैक टू इट्स नॉर्मल पोजीशन. ओके, बट कार्बामाइलेटेड एंजाइम हमने बोला था ये एंटीकोलिनेस्टेरेज कार्बामाइलेट कर सकते हैं या तो फॉस्फाइरिलेट कर सकते हैं. कार्बामाइलेट मतलब क्या होता है, ये यहाँ पे जाके ये इससे बॉन्ड फॉर्म करेगा विद द सी. ओके, एंड देन वो उसको वहां पे बाइंड करके एक तरीके से ब्लॉक कर देगा, और उसका जो फिर रिलीज होगा, मतलब ये यहाँ पे इसने कार्बामाइलेट कर दिया एंजाइम को, फिर उसका जो एंजाइम जो है वो उससे निकल जाएगा, बट इट विल बी वेरी स्लो रिएक्शन. मतलब हमारा जो, सपोज इफ आई एम गिविंग एन एड्रोफोनियम, ठीक है, तो वो उस एंजाइम को जाके कार्बामाइलेट करेगा और स्लोली वो फिर वो रिलीज करेगा, वो फ्री एंजाइम को रिलीज कर देगा. तो ये जो फ्री एंजाइम है वो बहुत लेट यू विल गेट, आई वुड से. सो यस, ये स्लोली उसको रिलीज करेगा, वो फ्री एंजाइम को स्लोली रिलीज करेगा. फॉस्फारिलेट मतलब क्या करते हैं, जैसे ऑर्गेनोफॉस्फेट्स फॉस्फारिलेट करेंगे, वो बहुत टाइम तक फॉस्फारिलेट करते हैं. ठीक है, yes, they do it for a longer time compared to the carbohylated enzyme. So the iska, if you want this thing to happen quickly, the step G to H, then you can give oximes. So oximes ये rapid conversion करेंगे and this enzyme is again free. So if you so basically what do this anticholinergic will do, they will just bind to that enzyme and they will not allow that enzyme to further inactivate the acetylcholine and thus increasing the acetylcholine action. I hope we understood. Coming on to Edophonium, we have already seen it's a reversible anticholinesterase inhibitor. Unlike reversible जो भी हमने classification में देते थे, ये reversible है. Coming on to the next part, इसका main important चीज is it is a short duration of action. So yes, here should be I. So duration of action is very short compared to other drugs. It has rapid onset. So this could be a question. This could be an MCQ. Which of the following anticholinesterase has short duration of action? So we have to remember it's Edrophonium. Okay. Coming on to the next part, it is an anti-curare agent. Okay, so we know curare tubercularian. So yes, it is anti-curare agent. So this question could also be asked that which of the following is an anti-curare agent. Okay, so remember it is Hydrophonium. Additionally, it has direct cholinomimetic action as well. मतलब वो enzyme को anticholinesterase से है ही, but it is also cholinomimetic. मतलब it also have this acetylcholine type action on skeletal muscle. Okay, then the other anticholinesterase. So yes, it is anticurare as well as cholinomimetic, direct cholinomimetic agent. Coming on to the next part, The anticholinesterase react with the enzyme essentially in the same way as acetylcholine. The same, जैसे acetylcholine उस enzyme से bind होगा, वही वैसे भी ये anticholinesterase भी bind होंगे, same way. Just that carbamates will carbamylate the enzyme, phosphates will phosphorylate the enzyme at the esteratic site. Okay. Then if you see the active region हम लोग ने देखा था, you have this anionic site. ये anionic site is near glutamate. So remember something like GA, anionic site at glutamate. ओके सो रिमेंबर दिस कि एनायनिक साइट कहाँ पे होता है और एस्टेटिक साइट कहाँ पे होता है, वो सीरीन और हिस्टिडीन पे ऊपर होता है. ओके सो वी हैव टू रिमेंबर दिस. You can also remember it as HES as histidine site, histidine एस्ट्रेटिक साइट है सीरीन. सो ये साइट्स दिए उन्होंने कि एनायनिक साइट पे कौन सा अमीनो एसिड होता है और एस्ट्रेटिक साइट पे कौन सा होता है. Coming on to the next part, ये बहुत important है. This is like very very important. Edrophonium and tacrine, they only bind to the anionic site and they do not form the covalent bonds. Covalent bonds, that means it will form a they are stronger bonds. तो dissociation बहुत slow होगा. So they do not form covalent bonds. And also हम लोगों ने देखा इसका action, duration of action is also very short. So they do not form covalent bonds and they bind to only the anionic site, not acetylcholine दोनों से bind करता है. But edrophonium and tacrine only bind to the anionic site. Organophosphates, they only bind to the esteratic site. Okay, and they form covalent bonds. Of very distinguishing points between edrophonium and tacrine and organophosphates, it's completely opposite, right? वो सिर्फ एनानिक साइड से बाइंड करते हैं, ऑर्गेनोफॉस्फेट सिर्फ और सिर्फ एस्टेरेटिक साइड से बाइंड करते हैं, एंड दे फॉर्म द कोवैलेंट बॉन्ड्स. इसीलिए द कोवैलेंट बॉन्ड्स आर स्ट्रॉन्गर बॉन्ड्स. वो अगर वो स्ट्रॉन्गर बॉन्ड्स उस एंजाइम के साथ फॉर्म करे तो वो एंजाइम का जो फ्री होना है दैट विल डिले एंड इट विल टेक मोर टाइम. Okay, so yes, this is very very important. Highlight this point. Okay, coming on to next, the reactivation of edophonium inhibited enzyme occurs in less than 10 minutes. मैंने बोला है, it has a shorter duration of action and it does not involve hydrolysis of the inhibitor, but only its diffusion action is brief. So its action is very short lasting. That is what we got to remember from this. Okay, coming on to the next part. So as I have said, it is used, I have mentioned in the first slide, that is used in the diagnosis of myasthenia gravis. I hope we know what is myasthenia gravis. It's an autoimmune disease where हमारी ही body antibodies बनाती है to destroy the nicotinic receptor or the muscarinic receptors. Okay. So remember this neuromuscular junction पे, this is a normal patient. So normal इसमें क्या होता है that you have this nicotinic receptors and acetylcholine will act and then muscle contraction will occur. But what happens in a myasthenia gravis patient is you can see यहाँ पे antibodies है जो nicotinic receptors को block किया, and also the nicotinic receptors are destroyed. They are no longer there. Okay, so then your action will be not seen. Okay, when it comes to myasthenia gravis patient, that is why you will have a muscle weakness, your muscle strength will decrease ultimately. Okay, so here also you can see here that the release site, यहाँ पे अगर normal in human being में देखो the acetylcholinesterase is enough. Okay, जबकि यहाँ पे in myasthenia gravis patient the receptors also decrease and this enzyme is also decreased. Okay, so we have to remember what is myasthenia gravis. Now coming on to its part, it resembles neostigmine actions, brief duration of action. We have repeated this point several times because you'll understand this further in the MCQ part. Coming on to next, it's used. Yes, this is what I wanted you to list it down, note it down very carefully, that it is a diagnostic agent for myasthenia. Okay, so you can see here, you have a test which is known as ameliorative test. Ameliorative test. It's a diagnostic test for myasthenia. So here you give Edophonium 2 mg IV as a test dose. And if nothing happens, nothing untoward happens, then you also give the remaining 8 mg after 30 to 60 seconds. So first 2 mg देते हैं, फिर 8 mg देते हैं. If the muscle weakness या जो मसल वीकनेस था अगर वो रिवर्स हो जाता है एंड द इम्प्रूव हो जाता है योर स्ट्रेंथ ऑफ योर मसल्स, दैट मीन्स myasthenia gravis है उसको. And if it doesn't happen, it is something other muscular dystrophy. So remember, if I give Hydrophonium and there is improvement in the symptoms, improvement in your muscle weakness, then it's a myasthenia gravis patient. Okay, In case Edophonium अगर नहीं है, you can also give neostigmin. Atropine pre-treatment is given. अगर हम neostigmin दे रहे हैं तो पहले atropine pre-treatment करना जरूरी है ताकि we block the muscarinic receptors also. Coming on to the next part, this is the structure of the Hydrophonium. You can see it is very simple structure. Okay, and here also you can see here its name that it is an dimethyl azanium. So yes, this is dimethyl, this is one methyl, this is two methyl, and this is known as azanium because it's an ion, and it is nothing but your ethyl. This is ethyl, and this is hydroxy phenyl group. Okay, so dimethyl azanium is its characteristic feature. Coming on to the next part, some brand products. Enlon is very common by Mylan Hydrophonium injection. Enlon by Mylan. So this is important when it comes to NIPER part where they can ask you the brand names. MCQ, yes, as I have mentioned it, very important. The drug used in the ameliorative test for Myasthenia Gravis. This is a very common question. So is it physostigmin, Edophonium, tacrine, or pyridostigmin? What should be the answer? A very important question which could be asked from this drug, that is Hydrophonium. So yes, it is used in this test, and this test is used for the diagnosis of Myasthenia Gravis. Coming on to the next MCQ, the short-acting anticholinesterase drug. I hope you now got it why I was repeating the point that it is short-lasting, because the MCQs are very common on this part. So is it Hydrophonium, Demicarium, Diflos, or Ecothiophyte? What should be the answer, you think? Yes, it is Edophonium. When it comes to short-acting anticholinesterase, you can blindly answer Edophonium. Okay, so we just have to remember 2 points. The drug Edophonium, its use, okay, and its action. It is short-lasting. Okay. Coming on to the last, which of the following anticholinesterase is used in diagnosis? Okay, so the question is twisted. It's not ameliorative test. Now they have given the diagnosis of Myasthenia Gravis. So is it acetylcholine, Edophonium, pyridostigmin, or rivastigmin? What should be the answer? Very important, very basic questions, very commonly asked question. The answer is Edophonium. I hope we understood what is important from this drug that we need to study. So yes, thank you so much for watching this video. So if you like this video, then please do like, share, and subscribe. Share it with your friends also. Also, we have you can press the bell notification on so that you get a daily update on the videos being posted on this channel. We also have a free WhatsApp group where we daily post MCQs regarding GPAT and NIPER. You can also follow us on Instagram, Facebook, and LinkedIn. Thank you for your time. Thank you so much.